We are going to discuss today why breasts are so significant in today's world. We could all be motivated for various reasons. Why, therefore, will we discuss why breasts are significant both biologically and from a reproductive perspective? The science of breasts, if you'd want, and naturally provide bravo to every mother out there who used these anatomical structures to make babies sturdier, those antibodies and other interesting things, substances present in breast milk. Thus, in addition to discussing the anatomy of additionally, we'll discuss the breast, the physiology of producing milk and nursing in addition to the components of breastfeeding. And sure, we'll also discuss a brief discussion of the aesthetics of breasts are present, without a doubt. Fascinating anatomy that humans possess inquiring about with regards to operations such as breast augmentations. So now, let's dive in topic. Therefore, let's begin by telling the tale of the breasts by examining a sagittal lower body. A slit has been made through the middle of a pelvis of a woman. Hence, this would be sliced here, while glancing to the right, and the vaginal canal is on the right here. Portions of both the uterus and the ovary. You may be wondering what to do right now. These structures of the pelvis are related to estrogen in the breasts during adolescence, secreted by the ovaries rises significantly. Estrogen has a lot of amazing roles, such as advertising the growth of second sex among women traits. And among those, the features of secondary sex are the growth of the breast's tissue are projections of the hemisphere that can be somewhat erratic in terms of size and composition of connective tissue and mammary glands. Adipose tissue is merely fatty tissue, and the elevated estrogen levels during puberty encourages the development of the mammary glands and moreover encourages increased fat accumulation, and everything expands the general dimensions and mass of the breasts throughout adolescence, either above or below this the pectoralis major muscle, and even partially envelop this muscle on the side known as the anterior serratus, and we will discuss this in greater detail later. Connecting the pectoralis major, especially when we bring up any details regarding the various kinds of breast augmentations. In a matter of seconds, however, the breast join these muscles having a fascia layer and are additionally held up by strands of connective tissue that connect the skin to the fascia referred to as the ligaments of suspensory, additionally referred to as the knee. It's intriguing that these, as we age, our ligaments do get looser. This causes the vessel to droop when the woman ages her breasts, and additionally, they may loosen up with extreme stress that could be experienced when prolonged running or other vigorous exercise activities. Hence, it makes sense to wear a sports bra can assist in preserving these ligaments' integrity, and as was previously explained, the mammary gland inside every breast, which is an altered sweat gland that secretes milk. About 15 components make up each mammary gland. Up to 20 lobes, one of which is visible ones shown in this image with circles, are these lobes are divided by varying degrees of adipose tissue, and its changeable capacity quantity of post-amputation tissue is among the items that support the variations in each person's overall breast size. Lobe that makes up a mammary gland of additional spaces known as lobules, and should we enlarge on any one of these lobules, we would observe that they consist of these grape-like alveolar structures. And these, the milk is lined up with the alveoli, releasing epithelial cells. And hence, just to somewhat retreat from each breast here, each mammary gland is present in divided into 15 to 20 lobes. Each lobe is composed of several lobules, and each lobule is made up of these numerous the actual milk-containing alveoli secreting cells, which accounts for all of the components or frameworks required to make and secrete milk. But visibly the breasts aren't producing milk all the period of time typically set aside for when a pregnant woman breastfeeds. There's this amazing gland found in the visible portion of your brain, referred to as the pituitary gland, and simply this is a sagittal cut to help you get oriented via the head, therefore it was sliced in this way. And if you had to immediately return from you would encounter this on the bridge of your nose. The pituitary gland, in particular the part of the pituitary gland that is anterior, will release the prolactin hormone. And as suggested by that moniker, prolactin will enhance lactation by raising prolactin levels, will increase gradually starting from the 6th the week leading up to delivery, by which prolactin levels have increased over time by roughly 10 to 20 times the average level of prolactin in a non-pregnant person. Female concurrently with her pregnancy, the placenta is releasing a lot of progesterone and estrogen, which leads to even more growth of the by making the milk ducts in the breasts expand, branch, and even bring about additional fat to accumulate in the breast, and all expectant mothers, before noticing these alterations with certainty, what is known as a rise in breast size. Fascinating information regarding estrogen and progesterone is that even while these hormones additionally encourage the growth of the breast during pregnancy, they actually hinder milk secretion in a manner that obstructs some of the consequences of prolactin, and hence negative impact on the majority of expectant women. 0 to a maximum of a few fluid milliliters are usually daily discharged from the breast till following the birth of the child, since when a baby is born, the placenta also born, and, as a result, is no longer inside of mom, hiding that further progesterone and estrogen that was preventing the milk from releasing. So now all the stored prolactin can withstand, enabling the infant to have their personal lactation station set up a few days before and a few days following. The liquid that the breasts secrete is referred to as colostrum and comprises comparable amounts of proteins and lactose similar to that of milk, but nearly absent. However, it does include antibodies in it, white blood cells, minerals, vitamins and development elements that are crucial for promoting the health of the infant and preventing infection. In the newborn in the coming week, the breast will begin in order to generate a lot of the normal breast milk, as opposed to the colostrum, and will obtain a small amount of more information about what's in breast milk in only a moment. So let's speak briefly regarding milk ejection, or what's typically known as a letdown, and this is the way this works. Milk is pretty cool, continually being secreted within as a portion of our mammary glands, discovered previously, but the milk does not quickly exit the alveoli and entering the breast's ductal channels, so when a newborn begins to nurse, the infant gets almost no milk for the first around 30 seconds. But after that, sensory mother's nipples contributions are transferred to the spinal cord via nerves cord, and those indications will ascend the spinal cord and arrive at this point this component, known as the hypothalamus. The hypothalamus will then inform the posterior pituitary gland to release a hormone called oxytocin and tell the greater anterior pituitary release prolactin. So these two hormones will be moving through the bloodstream. Nonetheless, it takes roughly 30 to 60 it takes these hormones seconds to arrive at prolactin in the breast tissues. Will continue to promote the production of milk within the alveoli, but when the oxytocin makes it to the breast, it will cause these cells that surround the alveoles. Exterior walls are referred to as contracting myoepithelial cells, and this contracture moves the milk out of the alveoli and into the ducts so that it is now possible to express and purchase milk to the infant, and this is known as milk ejection or disappointment. Now, another observations that are noteworthy include that using just one breast to nurse does not impact only that single breast, but it will also possess an identical impact on the opposing breast, so that both will have access to milk. If suckling starts on one side versus the other, and come back to this hypothalamus that we mentioned before, one of the hypothalamus's purposes is to control specific movements. Therefore, this explains why caressing the infant by the mother, or upon hearing the infant scream, cause an emotional signal to be the hypothalamus's processing, which can also lead to the same milk processing procedure disappointed to happen. So what's the composition of human breast milk? 88. 5% water, 3% fat, and 8% fat make up milk. Lactose, the primary carbohydrate casein, makes up 9% of the total protein in milk, 4% of other proteins and lactalbumin and the minerals, or 2% of ash like calcium. And it's fascinating to compare this to the makeup of cow's milk, and looking at this chart, there are components that are relatively close, but there are also some significant variations, like those found in human milk. Can 50% more lactose than milk from cows. However, the amount of protein in cow's milk is higher, more than twice as large, as the immune system's help is crucial. Breast milk is beneficial since it can milk-derived antibodies that would belong to the category of other proteins that the chart showed us, because in reality antibodies are proteins there. Can come in a variety of white blood kinds, cells found in milk, including macrophages and neutrophils, some of which are very deadly to specific kinds of bacterium. So let's just say thanks mother in terms of calories, since mom may burn between 600 and 750 calories a day only to make this milk, may be greater based on the quantity of milk is created, with a maximum capacity of 1.5 ll, occasionally even more, particularly in the twin case. Hence, now that we've discussed the capabilities of the breast tissue that several individuals who visit often Our lab is interested in the anatomy that affects how something looks, or more precisely, how the breast appears with relation to the cosmetic surgery. The current breast augmentation treatment, the breast's natural size and shape, is largely impacted by the size of the quantity of adipose and mammary glands tissue found in the breast, and once more, that differs from person to person, yet some items can also affect how something looks. The tension on those breasts' suspensory ligaments, which are clearly older in impact, and even the modifications that can happen during pregnancy and alter the breast size and form. As well as many of these modifications may persist even after breastfeeding and pregnancy are over, and the primary issue will be dealt with an augmentation of the breast, is the result of the implant. There are two main locations that come up most frequently concerning above the muscle versus below the muscle, as well as the muscle. We're referring to the muscle we discussed earlier, the pectoralis major once more. You can observe that I'm tracing with the probe over the muscle is now located here. Referred to as subglandular placement due to the implant's placement beneath or deep to the breast tissue's original state, but superficial to the main muscle of the pesi, with beneath the muscle or subcutaneous insertion the implant device is put deep to the pec main, well, at least mostly deep, but I'll get into it in just a second now. Whether a plastic surgeon and the patient decide to put the implant above as opposed to below the muscle or under the muscle is dependent upon several of elements, with one of those elements being the amount of native breast tissue that the patient has already. As a result of the patient has a minimal quantity of natural breast tissue above which the implant is placed. The muscle is typically not a wise choice, since this will probably display excessively of the device, and you may experience rippling. Hence, this individual may run for submuscular area where a cut is made would be produced along the less favorable edge, using the pectoralis major to make the implant's pocket. And this usually conceals most of the upper segment of the implant and provide a little somewhat more of a natural appearance, but a drawback of submuscular location is that recuperation following surgery may a little bit more painful, and you may get some little movements in rippling on the underside of the implant due to contractions of the pectoralis major, whereas you wouldn't receive as much of this movement during muscle contractions with subglandular location. So there are clearly benefits and cons to both approaches, why someone would plainly desire to have an appointment to see a plastic surgeon before making any final decisions. Among the many reasons I adore anatomy that you spend so much time in the lab is that you learning through doing. It's dynamic, and through hands-on activities, learning is active. The reason I'd like to present you to another one approach to learn by doing, and that is by expressing gratitude to the sponsor of the amazing, brilliant video of today, is an incredible interactive virtual education platform featuring thousands of lessons in programming for data analysis in math, science, and even AI. And ever since I started instructing for the previous 18 years, I frequently advise my pupils to attempt to reduce the request for blind memorization yourself and consider the reasons for this structure of the body known by this name. There was a sensible explanation for it. And this is another aspect about dazzling that I adore. Brilliant facilitates the development of critical problem-solving techniques to enhance cognitive abilities. Once more, it's not via blind memory, so as you're constructing genuine expertise on particular subjects, you're additionally developing one's thinking. And currently, one of my most cherished dazzling teachings that are assisting me in being a data exploration by a more capable mind visually, which aids in brushing up your ability to analyze and analyzing information from graphs and charts. It is very beneficial while you're examining graphs and charts on things like the hormones that today's lesson covered. Thanks for seeing and encouraging everyone to watch the channel. Please let us know what you think about what you considering the video. If you so choose, study more about hormones, including estrogen, which we will connect here with. Of course, we'll talk shortly.